Hello, Ms. Doe. Today we'll be doing your ROF, or as we call it, a report of findings, over some of the findings that we had during your examination process over the past couple days. So you came into us with some foot pain, and as a result, some of our tests indicated that you have something that we like to call plantar fasciitis. Now this is an inflammation of some of that connective tissue on the bottom of the foot that is causing you some of the pain that you're feeling in your calves and lower legs, as well as maybe contributing to some of your accidents and falls that you've been having. Now, in your thoracic spine, you had your upper back and lower neck area, you had some shoulder pain. We classified this as a vertebral subluxation complex, as we like to call it, or just segmental motion restrictions that you're having in your back, as well as some myalgia. So by myalgia, we're meaning just muscle pain that you're having in that area. So for the foot, we're hoping to treat this with some Graston technique and IASTM, which is where we take a little metal scraper and we're going to work the tissue and muscles in your feet and hopefully break up some of the adhesions or little balls of encapsulated chemicals that have been built up over the years in your foot. We're going to be using also activator technique for your spinal treatments and for that pain in your foot and shoulders as well. So activator is this little clicky gun that we have. We use this to decrease force and while still providing some mobilization in the joints. So these treatments we're hoping to help decrease your pain and restore some of your ability to act independently in your life and keep you from progressing in your condition. Now, the neurologist came back, as you know, with a diagnosis of ALS, and we won't be treating this directly. You and your neurologist will be treating this, and as us, our providers, our goal is to treat the issues in your foot and C-spine, but it will have some effect on your ALS condition. If you have any concerns or need to address us at any point about what you're going through, feel free to, as I feel myself to be a genuine resource for mental health awareness and just kind of the steps that people go through in depression, anxiety, and other issues that you may be feeling at this time. So we expect you to have some good results in our care. We expect you to be able to stay independent longer, and our goal is just to keep you from moving into the next stages of your progression for as long as possible. By that, we want to keep you in your home, happy, doing the things that you love, the things that you care about, and help with just a variety of issues that you may feel coming forward. So the benefits are that you're going to feel some relief to this pain. You're going to be able to walk around better. Hopefully you won't have to stay in the bed for 3 days and on like you did before, giving you just mobility and quality of life that people need at your age. And so we believe some of the risks to this treatment will be that you're going to have some swelling, some soreness, some tingling, possible tingling. If you have any tingling, or less sensation than you already feel, please let us know at that time and we will provide a re-examination of these symptoms. But some of the issues that you may come across is just feelings of soreness and fatigue after our treatments. This isn't always the case, but it may happen. And if it does happen, please let us know. So with any cervical adjustment too, there also runs the risk of an associated stroke. Now that is different from a correlated stroke in the cases where the adjustment in the case that the adjustment does not cause a stroke, but strokes have happened while people are being adjusted. Just like strokes have happened during surgery, while people are walking around. And one of the most common places that we find them to happen is actually in sports accidents and daily activities around those. So other forms of care that may be beneficial to you, we've referred you to that occupational therapist that'll help keep you functional and happy in your home for as long as possible and really help to decrease the number of falls, we're hoping, and accidents that you're having occur. As well as the neurologist, who's going to be more the pharmacological or medical side to your treatment, whereas we hope to be the musculoskeletal treatment, keeping your bones, muscles, and joints, trying to keep those as pain-free as possible. Do you have any further questions or concerns for me at this time? We have some paperwork that we'd like you to fill out, including informed consent, and here is some information about your condition as we have in these reports. I hope that you can come to us anytime and that we are a source of help and inspiration in your case, and really provide you with the care that you need to get better and keep you as independent and as good as we possibly can have you. I'd like to thank you for your time today and hope you have a great rest of your day.